Okay. All right. And one thing I was going to show you are labs I had done by my primary care physician.
When were those done?
Those were done on last week, the 9th. Well, that wasn't last week. But those are those. And I think we got all the meds updated.
All right, hold on 1 second.
Okay.
So I can date. This is 10/8. It looks like 10/8.
And you may have that.
What's your dose of vitamin D?
I think it's 3,000. Well, I think it was 5. Switched from 1,000 to 5,000. This says, but then I think the prescription bottle, which I didn't bring, said something MCGs.
Well, it actually is in international units.
Okay.
But that doesn't matter.
But I am almost out of that, and I need that refilled.
This is your metabolic panel.
I'm sorry. You were looking. I switched to prescriptions. I thought he went from 1,000 to 5,000 in late August.
So we need vitamin D.
Yes.
Well, Miss McQueen, it seems to me like you've had a bit of a worse time.
Yes, the last 2 or 3 weeks, and since that last chemo.
That's what
I mean. And my fall, and yes.
Since then, okay. So, do you feel that the symptoms that presented, and what I mean is this fatigue, the loss of balance, and the kind of tumbling, this you did not have last time.
No, I started that about 3 weeks ago.
Do you feel that it was after the Temodar, after we increased and you started? Did any of these happen before that time?
No, I don't think so. Because I think that was a Tuesday that I fell. And then I think it was Thursday that I started that higher dose. I had all this stuff written down on a calendar that I don't have now.
Fortunately, you put it
onto
my chart, and so it is documented.
All right. But I feel like it was. I try to keep all those dates written in a list, and then I end up getting here and don't have them.
That's okay, because you do a very good job communicating in my chart. So, given these, what I perceive as changes, I've only met you once, but the report that I got when I met you was not the report that I got ever since.
No. And this has been different, and I've had a lot of urinary incontinence, and I'm trying to figure out how to balance exercise and rest and hydration and having to get up every hour so as not to wet everything. That's probably a little bit exaggerated, but...
Have you given up your morning walks?
We walked 3 days last week.
Okay.
And then I haven't been there this week. But we walked in Costco, and I ordered glasses Monday. That was probably less than half a mile, but
we spent a long time.
So I'm trying to walk, but
my question in my mind that I want to be in your mind is, even if blood work looks great, do we want to continue at this increased dose? Because the alternative is, and let me get myself straight, because I remember last time you had maybe just come back from a trip.
Yes. We did 2 cycles at the lower dose.
Yes.
And then that last cycle at the higher dose.
Yes. And I'm just going to make sure that this one is at 200 milligrams per meter squared. So I feel that we have 2 different options, and I think that it would really help me to have the expertise of Dr. Morgan weigh in. We can stay at the 150 milligrams per meter squared 5-day, or that other option that we call metronomic dosing is 50 milligrams per meter squared every day. Not for a week.
Every day.
And the metronomic dosing is the lowest effective dosing, definitely in the literature. And in fact, over the 30-day period, you're getting more temozolomide than you are on the 5-day, even at the 200 milligrams per meter squared. But that means that you take it every day of the month, and then you pick a week of the month and be like, okay, first week of the month, I'm getting my labs checked, and they'll appear because you're NASH, right? Which facility? Rockingham. So you would just go at around this. It doesn't have to be the exact same day, but around the same time every month, just so that we are making sure that the white cells are good, that platelets aren't dropping. And if lab work today gives us a clue that your bone marrow is saying, I'm not a big fan, then that's further impetus. But even if labs look great, I worry about how you have felt since September.
Yeah, I mean, it's 2 or 3 weeks ago was kind of I was feeling like people had described many people feel after you finish radiation. And see, I had very little problem with the radiation and chemo. And so it was kind of like, this is really different. And I wasn't sure if I'd ever feel better, but I have gotten some stronger. So, am I answering your question?
I have go ahead.
Do I want to do it every day or 5 days?
You don't have to decide that at this time. Like, this is not we need to know right now. Your lymphocytes today took a little bit of a drop compared to the 16th. Which was after that second cycle of 150 instead of 200. So those are down a little bit. It's not enough for me to say, nope, that's an absolute contraindication. Your platelets are still good. They're 236,000. And with the last dose, it was 282. And so your general white cell count is fine, 7.6. Are you still on dexamethasone?
No, we finished that in...
That's right. Before I met you, you just finished it.
I think so, or about that day or two. Here, I have every bit of that written down.
That's okay. Your data keeping jogs my memory, but I recall
I was...
So, overall, looking at this blood count, the lymphocytes have dropped. It's not a deal breaker. The platelets are good, the hemoglobin's good, the white cell count overall is good. But how you feel gives me pause. And I want us to take that into consideration.
So your recommendation would be to do, I think you said metronomic, but
the lowest possible dose is called metronomic, but basically we can refer to that as daily dosing. That would be a smaller dose of temozolomide every day of the month.
And it should be done at bedtime.
It is the same with the Zofran. All of that is the same. And in fact, if you do have the nausea, when we knock the dose down, then that nausea should, in theory, get less. However,
I've not had any so far. So
if you have fatigue during your cycle, it is possible that we give you a little more chronic fatigue because it's staying in your system. It's not 5 days and then a couple days of recovery. It's in there.
But if I stay on the 5, I need to stay on the dose I had this last time.
You could, or we could go back to 150 and see if you feel better.
How does that affect treatment?
It's not the standard of care, but if it meant, if you were to, here is where they don't give us if then, but one option is to say stay on 200 and let's see if your 3-day walking becomes 1 or 0 days walking. if your couple tumbles become regular unsteadiness without assistance, furniture, or rollator close by, we can do this trial and error, or we can go back to the 150 and say, hey, maybe 200 was just too much for me, which is not the evidence-based, but it's something that is done. It is something that we do.
Okay, if I stay on the higher dose, which is what I took last time,
Mm-hmm.
that's 5 days.
Mm-hmm.
And then if it seems, I'm trying to think this through. If it seems that doesn't treat me like it did this time, then we would know that whatever I was experiencing maybe wasn't that, but then we'd wonder what it was, right?
Right, and it can
decide.
merit further investigation. I'll tell you what also throws a wrench into the matter is that next month we expect to get an MRI.
Yes.
So if we went 200 and then 150 and MRI looked good, then we'd be like, oh,
maybe that's enough.
And so
I really was kind of thinking maybe we could go back to the lower dose to see if that helped me feel better.
it is,
But
this urine issue is a real confounder to me.
well, I mean, and he did the urinalysis and nothing showed up. Something I did read, though, about of the drugs, and I think it was the TMZ, mentioned some of that, but then I hadn't seen that elsewhere, I don't think.
And I don't see it in clinic.
Okay.
I would say with any,
Okay.
honestly, this is the
First time you've heard
Mhm.
that.
And
Okay.
that having been said, we've had urinary symptoms that have ended up being a UTI.
Okay.
But I feel like I would be stretching to
To
attribute
think it was
this
TMZ.
related to the TMZ. And again, I'm going to ask Dr. Morgan to weigh in on it as well.
Okay.
But we're just in this spot where we can
We don't
do
really know.
different
Okay.
things.
Well, what would you vote for?
I would vote for going back to the initial dose and seeing if it affects.
If it makes me feel better, then I would
And
know
then-
perhaps it was the dosage. And I mean, my main objection to the switching to every day is the scheduling of all the fasting and then the half hour before and the chemo, the half hour for the Zofran but I mean that can be done.
And I'm not, what I would feel most compelled, and I just want to read your MRI report again,
Okay.
because I want to see if there was any spot that has grabbed our eye. Stable post-treatment, no increase enhancement or edema,
it
subtle
looked pretty good.
diffusion. Right, I do remember it looking pretty good. And so then I would say to myself, if there was any spot that we were watching, I would want to stay at highest dose, which is standard of care.
Yeah.
Get that MRI in 1 month. And then if there is any evolution on imaging, then that changes the whole game anyway.
Yeah.
But then the other thought is, we did 2 cycles of 150, 1 cycle of 200. If we go back to 150, and this shows any evolution, do we say, oh, darn it?
Yeah.
We came down. Or because you had more cycles of lower than standard of care.
So maybe I ought to try the every day, the less amount.
Does it have a cumulative effect? The everyday?
So the cumulative effect of the medicine is a higher absorption of the chemo itself.
On a daily basis.
Some patients tolerate this way better, and some patients still have the same nausea, and it's low. I mean, all of these
I know
things
it's
have.
hard. As I'm reading and everything, I think there are just so many variables. It's hard.
It is,
Figure it
and
all
I
out.
think this is where we have to treat a human being and not a scan and not a lab result, and that's what muddies the waters a bit. Let me just check your other labs as well. And I also, I want Dr. Morgan to weigh in because of her pharmacy knowledge about
Okay.
absorption and
Right.
sort of vitamin D. That CMP still isn't up yet, which is okay because your CMP from October 8th looks great, so I don't really have any burning concerns about that.
Okay.
But I'm going to see if I can scoot over to the other clinic and have a word with Dr. Morgan. ASC of 600 compared to 1100 on mine.
And that's what?
That is your absolute lymphocyte count. And we know that temozolomide affects that.
Yeah.
So 916 ALC was 1100, 1020, 600. And sometimes, so I'll tell you what that implication is, sometimes we have to check your CD4 count. And if your immune soldier cells have been knocked down, we give you a prophylactic antibiotic to take Monday, Wednesday, Friday, just to protect you. So that's what that entails. I don't think we're there yet. Like I said, this isn't a deal breaker. I probably should expect it to go down on account of having the 200. And just tell me what your day 5 was or your day 1, so I know where labs are today.
Day 1 of last cycle.
Yeah, it's on this calendar, I think.
Day 1 of last cycle was.
That's October then.
I know, but I was going to count backwards, but.
927 was cycle 3, day 5. Does that sound right?
27 or 26, yes. One of those two. September, wait a minute. September
Yes.
27.
Was day
Yes, day 5. I'm sorry.
September 20.
Thank you. That's correct. And tomorrow, I think, was to be day 1.
Right. And so, given our information and interaction with you, Dr. Morgan on the 29th discontinued the automatic refill of the same dose, saying that we need to assess you. So she was prepared to dose reduce, and that's the whole reason to bring you in, recheck labs, and see kind of what your thoughts are on the whole thing.
Okay. Did you say on the 29th?
Yep.
So we're going to put it off another week.
No. So what I'm saying is that it would have already shipped, but we held that shipment.
Yes, right.
So
Okay.
that if we decide
And I need to get that shipment today, or have it sent to her Raleigh address instead of mine at home. I know that complicates that too, but we got to figure out the dosage first.
I think and if it's off by a day or a couple, that's no
all right.
big deal.
Okay. On the one hand, I think. Well, I just think so many different things. On the one hand, I think, should I try that same dose again and see if it treats me as badly, or if I should go to the everyday but lower amounts.
Well, I know how much the scheduling has to be so precise. I know how much it bothers you.
I want to ask you this, and this is going to be a memory jog.
Okay.
After radiation,
Mm-hmm.
when you started, because your amount at radiation was low.
Yeah.
And then we doubled it.
Yes.
In those first 2 months after radiation, did you have any of the shock to yourself that you have this past month?
No, because I was walking most every day. I didn't have any of the incontinence. Of course, I know we're saying that might not have affected it.
But weren't you on a lot of steroids?
I was on steroids, but that finished shortly.
Your steroids have been on and off.
Yes, but the last bunch. May I do this a minute?
Yeah. You do not have to recall all this.
Okay, but I'm just trying to think if. I think about the same time I fell, I finished the steroid, like right in that same 2 or 3 days. Don't you remember? Do you remember that part?
I can tell you it was within days that you contacted me.
Yeah.
Let me look back. You had. Hold on.
Seems like it was a Thursday.
Lost balance and fell over on September 23rd. We talked
Okay.
about that. And when I saw you on September 20th, you had just finished Dex on the 16th.
Okay.
So Dex was already out of the
It was
system.
already out of the
Dex did not contribute to the fall.
Okay.
And you got medicine on the 22nd. And on the 23rd, you and I had a conversation.
About the fall.
And,
So that was just one day after.
and you had already started with, you said, profound fatigue, low energy, weakness.
Yeah.
And so you.
So that really was before
Well,
the dose of.
so right, you and I communicated on the 23rd, 26th, and 28th. After,
Okay.
because that was when Ines.
On the 23rd.
28th, the 27th, maybe. Anyway, there UTI off the table, dexamethasone off the table. I feel like this, the medicine was shipped on. You received it. Wait, let me confirm that. But anyway, you received it, and all of these were within a 7-day span of you
You
receiving
finished it on the
this.
27th.
I do feel that staying on the 200 is not going to serve you well.
Okay.
Your bone marrow is
let's-
okay.
Well, let's go. So, going back to the lower dose, you said we can try that, and then with the MRI, if we see any major changes, we could make changes again.
Well, I'll tell you, if we see a significant change on the MRI,
It'll be
then
whole
temozolomide is done. Temozolomide. But if we see a minuscule change, then we have to do our calculations to
Again.
say, does the 50 milligrams per meter squared get you
What I need.
fighting this more than 155 times a week?
okay.
So that's just our number crunching to get you the
Okay.
most bang for your buck. But I think now that I have relooked at all of our
Okay.
communications, September 22nd through 28th was awful for you.
Yeah.
That is exactly when you were on.
Okay. Let's go back.
Okay. And we're going to go back to the 150, which is the same dose you were on right after radiation,
Okay.
and the same dose right before.
Cycles 1 and 2.
Correct.
Okay. And, now, I either need, like I said, I either need to pick that up or have this sent to not my home address, but my cousin's home address.
And do we have that in here?
No. Here in Raleigh.
If I can get this started. Do you often speak with Sonali? when
Yes,
she ships it?
uh-huh.
Okay, I'm going to include that.
She's usually the one that calls to schedule.
Receiving 150 milligrams per meter squared, and I'm just going to double check that dose because you were on it before. Any significant weight change?
No. It's about the same it was right before my surgery.
But she's eating less now.
You think? I don't
You are from last time I was
Okay.
with you.
I also feel that when you feel as poorly as I think you did, appetite is blah.
And there are times when certain foods that I used to like, it's like I don't believe I can stomach that. But anyway, I'm still eating enough. I'm still at 266, and that is just about what I was for about the past year, probably.
Day 1 was supposed to be tomorrow.
I think that is right. Yes.
Okay, what is the address? I'm gonna write it first while the runner you put Attention.
Marsha McQueen. I don't think they'll reject it because it's got my name on it. Or should I put care of?
Do you have to sign when it comes?
Well, they say so, but then they bring it, and if they see me, they don't. They say because of COVID.
Oh, good. Okay. So then, 8708 still needs.
Stonegate's one word.
And this shared service pharmacy is in Raleigh, so I think it's a pretty good chance that we can make it happen.
Okay. Well, I'll just start the next day. I don't think no, they'll bring it to the door, so it can be.
Now,
All right.
while I'm waiting for them to kind of process that,
Okay.
I kind of want to see what is different than since our September exam.
Okay. One thing I was going to tell you, 2 or 3 days this week, I have not taken my diuretic that's one of my 3 blood pressure medicines. That has let me only have to get up once at night. But then I'm wondering about my blood pressure was up a little bit today, but that's sort of
What was it when she checked?
188 over 98.
Yeah, I don't
So I
love
probably ought to
that.
stay.
But the other thing is, did reducing that hydrochlorothiazide make any difference with urinary incontinence otherwise? Like, are we draining fluid too fast, too much?
Well, that's what I wonder. And I wonder if I should, I'm trying to drink plenty, and yet that's another one of those things like the rest and the exercise. Hydrating and then draining too much.
On those nights that you only had to get up once, during those days, did you have as much leakage?
Not as much.
Not as much. But
I still had some.
Yeah, I don't want 188 over 100 to be our new baseline.
No. So we'll stick with it.
Yeah.
And a couple of days, yesterday, and like today, I haven't drunk as much today, knowing I would be here and around.
Right.
And haven't had an accident yet today, so.
Well, I think that, I don't ever want to encourage dehydration.
Right.
But you are one of these. Fluids are good for me. I will drink lots of fluids. And if you feel good and you're not getting dehydration type headaches, if your bowels aren't getting kind of slow and constipated, I think it is okay to sort of cut back because we've got a diuretic. We know that you're an awesome hydrator, and this is not helping your quality of life to have a bladder that behaves on its own.
Right. That's a good way to say it. It behaves on its own.
Misbehaves is better for her.
Okay. Sounds
So I
good.
think,
And I know that, if urine gets dark or real smelly, that you're not hydrated enough. But okay, I'll just cut back a little bit.
I think it's worth a try. We had the conversation about liquid IV, right?
Yes, and I have it. I've only used it once, though. I thought I'd ordered it and then did that.
Listen, first of all, it's a strong taste, so if you only do a half cease, that's okay. There is no scientific evidence behind that technology, but it's advertised that one bottle with liquid IV is supposed to be as good as 3 water bottles on a cellular level. So,
I saw that, and I think most days since I've had a lot of this fall and weakness, I have drunk either 6 or 8 ounces of Gatorade, or I did drink one of the packets of the liquid IV one day this week. So
that's just
I'll probably drink a little bit.
I don't want you to stop drinking, but
right.
I think you can get away with less and be okay.
Okay.
The other thing that is important to me that it's a hard way to ask when we're 2.5 weeks out, but that first week we were somehow in contact every day to every other day. After that week was over, is that when you found yourself feeling better about walking? Did the steadiness on your feet return, or were you still pretty down and blah?
Well, I was not sleeping as much. I was walking only with the rollator, and when I got tired, I would turn around and sit till I felt like walking again. So it was better, but not
your
well.
Pre-high dose baseline.
Right.
So this last one just kind of pulled the rug out. Let me listen to you for a minute here.
Alrighty.
Big breath. One more. Relax and breathe normally. Does that make you feel woozy taking those big breaths? I'm just going to kind of pinch on your skin a little bit. Flip them over. I'm just gonna. Are you warm natured, cold natured?
Warm natured.
Okay. Squeeze me tight. Okay, to make it hurt. Good. Same or different? On your skin, same or different?
Same.
Across your forehead on either side.
Same.
Inflate your cheeks for a moment. Relax. Stick your tongue straight out. Good. And a huge smile. Perfect. I'm going to whisper a number into each ear.
Okay. 2. I whispered back. 5.
Mm-hmm.
Okay. I do still have, this hand has some, I don't call it numbness because I can feel it, but I guess weakness. I have to be careful, especially if it's a liquid, that I've got hold of it really well. So it's not automatic. Yeah.
But it's not consistent. Does this
No.
catch you like when you're more tired at the end of the day?
Often it's more at the end of the day. Or when I've first gotten up, like, I'm not like fully awake.
Okay.
Moving around.
Can I slide your glasses just
Oh, yes.
just a little bit?
You were supposed to have gotten a report from my eye doctor last week.
They may have scanned it in the right place, but I'm glad you told me because I don't often
Oh.
look in that place.
Okay. And he did my whole exam, and then when I told him about my GBM, he also did a visual perception, which seemed to me to be like peripheral vision test, and it did show a very limited deficit in this circular design he had in the left lower
On the side,
field. Yes.
left eye.
Well, it was just this. No, it wasn't necessarily left eye, but it was just this circular diagram that he had.
I know exactly what
Okay,
you're talking about.
alright.
Were you in a
But-
bowl that you pressed
Yes,
a button
right.
when you saw a flash?
And he said we sometimes call it pile on the floor. He said, the area that's going to be bothersome to you, and he said it's a very limited amount, would be like if something's down at your bed.
So
Which would apply, he felt could very easily apply to where my GBM was.
okay. When you looked, did he show you the paper with the circles?
Uh-huh.
And so I don't see it in there, but we can get it. It's no problem.
But at the bottom, the circle was here, and the dark areas were down in here.
And those dark areas were on both eyes, or one
Well,
eye.
I don't know that.
Okay.
Because
We'll
she
get it.
tested
We'll get it.
each eye, but the only diagram he was showing me was one big circle.
Lower and lateral quadrant. Okay, that's okay.
And he said it seemed to be a limited amount, but it would make sense related to where my GPA got it.
We'll work on getting that. I did get a word back from Dr. Morgan is writing it. Shared Services should be able to deliver it tomorrow.
Okay.
So
With
you may
my
get-
D3.
Oh, I have to give them the address.
All right, thank you. And I have plenty of the Zofran. Of course, somebody will probably call. We're still recording.
All right, address is in. Both Dr. Morgan and Sonali are aware. They are hoping to get it to you tomorrow.
Okay.
So if you get it tomorrow, you can
Start it
shoot me a my chart that says starting this evening.
Okay. All right. I appreciate your responsiveness. Was very pleased to hear from you directly when I wrote about the fall. And I think I did one this long of a list this time.
Okay.
Left hand all over weakness, incontinence, and hydration, exercise and rest. My D3, chemo, her address. You think of any questions?
No.
But I'm not done with you.
Okay, that's
But I
fine.
don't want to cause an avalanche because I
You
want
won't.
I want to see your strength and mobility.
Alrighty.
'Cause
I'm going to give Glenda my avalanche. You can put it all in the folder.
All right. First, do you care if we walk out of the room briefly?
I don't.
So I
Am I
can
going to leave this here?
No, I want you to have.
I was trying to say if I am, I need to hold on. I mean, and it's not like, it's not weight so much as it's kind of trying to keep.
You and I are just gonna walk to
Okay,
this wall,
we can do that.
and I want you to tell me, is this your normal pace?
Yes.
Okay. Do you feel any wooziness or unsteadiness?
No.
You're
No,
steering
not right
very
now.
straight.
Yeah.
Now go ahead and make a loop around. Both legs feel like they're doing what they should to keep you up. Neither of your feet
Right now.
is dragging that I can
No.
see. When you have to navigate a step or uneven ground, does your foot ever not go where it's supposed to?
Uneven ground, not steps. I don't usually use this. I'm usually holding on the handrail
Okay.
and usually do okay.
Okay. Good.
My feet go where they're supposed to when I'm going up and down steps, don't they? Holding
Yeah.
on to the rail.
Yeah, but she wants a little husband that go upstairs.
Yeah, I wouldn't go all
I
the
mean, I
way
have one
upstairs.
bedroom downstairs and she's using that.
What
The half
if
bath.
every ground was like this, then I would have less worry. But changing position
Right.
and knowing if that hydrochlorothiazide is on board and you've been voiding like crazy and depending
I'm
where
gonna be
you are.
with. Okay. Well, so far I have not gone very far at all without the rollator or the walker, and then there's usually furniture or like in the half bath, it's, the walls are very close to you.
Kick this leg up to my hand and push against it.
Push against your hand.
Push. Good. Can you lift this thigh up to me?
A little bit.
Good.